Let's continue counting down the top 2023 advances in breast and gynecologic cancer. I'm Dr. Eleanor Toplinski. I am a board-certified medical oncologist specializing in the treatment of breast and gynecologic cancer. We already talked about number 5, which was survivorship and quality of life updates, and category number 4 is updates in molecular testing. Molecular testing is a really broad category, but it's looking at changes in genes. We have germline genetic testing, which looks to see if a person inherited a mutation, and that's a blood test, inherited a mutation that increases their risk of developing cancer. So, for example, that's testing for the BRCA gene mutation, CHEK2, ATM, PALB2, BRIP1, and so forth. There are many. A study published earlier this year showed that a substantial number of patients with breast and gynecologic cancer who qualify for genetic testing are not getting it done. And I think this is a big concern that we really need to be paying attention to and bringing with us into 2024 to make sure that all of the patients who qualify for testing are getting it. So if you have not had genetic testing, I urge you to talk to your doctor to see if you're eligible, because not everyone is. Eligibility for genetic testing is based on diagnosis and family history. We also have genetic testing of the tumor, also known as genomic testing or molecular testing, where we take a sample of the tumor or a blood sample that's known as a liquid biopsy to identify any alterations or mutations that could be driving growth of the disease, and in some cases actually identify drugs that could target that particular mutation. For example, in 2023, we saw the approval of a drug called elacestrant, which is used for patients with hormone receptor positive, HER2 negative metastatic breast cancer who have an ESR1 mutation. In ovarian cancer, for example, patients whose tumor has a BRCA mutation or exhibits homologous recombination deficiency, HRD, may be a candidate for a class of medications called PARP inhibitors. So these are some of the ways that we use genomic testing to guide treatment. In 2023, we are seeing increasing use of liquid biopsies, which are non-invasive blood tests that detect circulating tumor cells and DNA. And they can be used to guide treatment decisions. There's research looking into these tests to see if they can identify recurrence or risk for recurrence. And there's different tests approved based on the tumor type and what exactly we are looking for. But when I talked about that ESR1 mutation with elacestrant, we can do a blood test or a liquid biopsy to see if someone's tumor carries an ESR1 mutation instead of subjecting them to a biopsy, either a surgical biopsy or with radiology, which obviously is a lot more burdensome for the patient and carries a lot more risk. So I'm really excited to see where this field takes us in 2023, how we will continue to use molecular testing really for precision oncology, how we will use more liquid biopsies, and I think a big focus needs to be on making sure people have access to germline genetic testing. Let me know what questions you have and come back tomorrow as we count down number 3.